Good morning, everybody. Thanks for showing up for this. We're very excited. I'm Jessie Ice. I'm the Executive Director of West Virginians for Affordable Healthcare, and I'm joined today with the West Virginia Healthcare for All Coalition, which includes the Center on Budget and Policy and West Virginia Citizen Action Education Group. And I've got representatives from both today, and we're here to talk about a Medicaid buy-in. That has been introduced in the House, and we're super excited about it. And I'll tell you why. Back in 2013, we passed the Affordable Care Act. Excellent. This was super good news for West Virginia, and we took a step further. And what we did was expand Medicaid for working families in West Virginia who are making up to 138% of the federal poverty level. That worked out great for West Virginia. We saw our unemployed rate drop from, I want to make sure I quote this right, it was about 14% prior to this, and then after it was closer to 5.3%, I believe. What? Uninsured. Sorry. Yeah, not insured. Gosh, that would be terrible. No, uninsured rate. My mistake. So it dropped, and then as the years went on, we saw it creep back up for various reasons. Economic reasons, education, people moving from the state, moving into the state, all sorts of, the compounding factors are numerous. But we saw in 2019 that number of uninsured keeps creeping back up. So every year it's creeping back up, creeping back up, creeping back up. And why? While the marketplace is an excellent source of insurance for folks, especially if they don't get it through their job, because we've tied employment to work in this country, which has its own issues. But one of those issues is that a lot of jobs don't provide health insurance. So once you get to a certain level, you also disqualify yourself and your family for Medicaid. And Medicaid is used by nearly a third of West Virginians. I think the latest numbers was 29 to 30% of West Virginians rely on Medicaid. And then there's this little gap in between those who have Medicaid and then those who have employer or ACA marketplace insurance. And these folks are the ones we're trying to target. They're the ones who can't afford marketplace plans, but also don't have the Medicaid or the employer insurance option. So what this bill would do, House Bill 3001, it would create a Medicaid buy-in program for West Virginians to fill that gap, that 6-7% of West Virginians who can't afford insurance, don't have insurance, but outmake Medicaid when it comes to wages. So a Medicaid would basically help those West Virginians who don't qualify here, don't qualify there, or don't qualify this third basket that we've got going on right now, and allow them to have something that they can purchase to protect their families when it comes to health insurance. House Bill 3001 was introduced last year by Delegate Worrell, who's here today. Thank you. And it's back in this year, and I think it's really a good time to have this discussion. We're in a pandemic, people are worried about their health care, and we know that healthcare is one of the top concerns for every single American and West Virginian. So this is like the time. Let's fix this gap that we've got, and we can do it. So today, to talk more about this, we've got a couple people here. We've got Judy Stevens, who's going to tell his story. He works with the West Virginia for Healthcare for All West Virginia campaign. He'll give his story next, then followed by Delegate Worrell, who introduced the bill, and Delegate Plush has also joined us today. She's somewhere in here. And then Kelly Allen from the Center on Budget and Policy. So listen to what they have to say about this bill. I encourage you all to reach out if you think this is something that West Virginia needs, like we do. And with that introduction, I guess I'll turn it over to Delegate Worrell.
All right. All right, well, thank you, Jesse, I appreciate it. I am Evan Worrell. I'm a Republican from District 18, which is part of Cabell County, Barberville, and Salt Rock. First thing to say thank you. I need to say thank you to West Virginia for affordable healthcare for all, and the biggest thanks to the West Virginia Center for Budget Policy. Thank you as we've worked through this idea of Medicaid buy-in. And I'll give a quick little reason why I support this, why I want to introduce this and go forward with this. I have seen people in my area that have quit their job because they were going to make too much money and they were going to lose benefits for their family. I know people who've done that, and that's unacceptable. People who are working, people who are trying to do better for themselves and their family, that because they make 50 cents more an hour, which is a great thing, don't qualify for benefits. And when we say we don't qualify, we call it a cliff effect for a very reason, because it is not something that just gradually goes down or whatever the case may be, you fall off of your benefits, okay? So if your employer offers commercial insurance, for example, at $400 a month, that's cheap. But the reason why I'm using that number is because you break that down to a traditional 40-hour work week, that's about $2.50 that you'll have an hour that you'll have to pay for that insurance. So your 50-cent increase in pay just lost you a net of $2 an hour. You can't afford it. So Medicaid buy-in, it just seems so simple, right? We need to provide a way for people who are working, trying to do better for themselves and their families, to still have benefits. And they even get to have some part of the stake in the claim, right? They pay a little bit for their benefits, and as they continually to make more money, and do better for their families. I don't want to say that money means better for your family, but being able to provide, let's say, for your families and your children. This would alleviate that effect, because that's our hope anyway through a buy-in process. So it's extremely important. I think it's something that we as a state can do. I know we can do it. It doesn't always seem like the most popular thing to do, because I know a lot of people look at it as Medicaid expansion as being some bad thing, but I've never operated on that since I've been here my 4th year. I believe that we need to find ways that we can help people that want to do better for themselves. We're talking about people who are working, who are trying to do good things for themselves, have a career, grow themselves, grow their families, and then we're saying, oh, sorry, you just lost all of your benefits for you and your children because you're doing better for yourself. And to me, that's unacceptable. So that's one of the reasons I believe so heavily in the Medicaid buy-in. And I'm hoping that we have a chance to pass it this year. I've had many conversations with our health chair. That's where it is right now. And I know that they've asked for a fiscal note, but there are not huge fiscal implications to the state, and that's where this becomes important. This is something we can do, and I'm going to go ahead and say it's something we must do. Something that Delegate Plush and other things we fought for, like insulin caps, and help for that. We've also worked before on Medicaid expansion for pregnant working mothers, for adult dental benefits. There are things that we can do, and we have done as a state to say that we support working people. And this, to me, is not just the next step. It is probably one of the largest steps as far as Medicaid Cliff Effect counts for. So with that, I don't know who I give it to next, but I want to say one thing. Sorry, I'm right here. Please reach out to members of the health committee. I implore you to call, go talk to them in their offices. Please go say, run this bill. It matters that the public has a say in us running the bill. It matters that you go and talk to these delegates and senators and say, please, we need you to run this bill. And I'm hoping we'll hear some personal stories of why this is so important. So, all right, that's it. Thank you.
Now we're going to go ahead and ask Jude to come up here and share his story. Judy Stevens, he works with the Healthcare for All West Virginia Coalition.
And one quick second so that I can see clearly. Glasses and mask don't mix super well. Good morning, everyone. My name is Jude Stevens, and while I was born in Wood County, West Virginia, I spent most of my life living in Georgia. My story with healthcare kind of starts after my mother passed in the summer of 2017. About a month and a half later, my father slipped into a coma due to a motorcycle accident. We weren't expecting him to be out as long as he was, and in the process of trying to keep the family house and everything running, I had lost all my savings. Money that was going to go towards finally moving out and living on my own. About a month into my father's 5-month coma, I was left without a home. My depression was at an all-time high. I even considered suicide after losing basically everything. But I was fortunate that my grandmother was there for me. But she was 500 miles away in West Virginia. I didn't have health insurance, I couldn't afford treatment, and she was the one who helped me get on Medicaid. And I was finally able to begin my treatment and start down the road to mental recovery. I went from someone on the edge of self-termination to someone that my mother could have been proud of. And more importantly, I could be proud of. Today, West Virginia has become my home, and even though I have the choice to return to Georgia, I want to stay here. While I was recovering, I lucked my way into a nonprofit position. I get to use my experiences and skills to educate families, assist them with the resources that are required to escape poverty and find employment. And I didn't get into nonprofit work to make a fortune. I live a fairly modest lifestyle. I drive an older used car. I don't eat out unless family is treating me to dinner or something. My current dilemma is that I have been given the opportunity to work more hours at the job that I absolutely adore. The amount of hours I could take on potentially would put me over the Medicaid eligibility cap by only $157 a month. I have checked with the health care plans that would be available for me and that I would qualify. And with the new hours, I would be losing out on $150 a month instead of gaining anything. Instead of making more income at this point, it would be detrimental for me to work more. I can't risk losing my health coverage to pay for a private plan. And the nonprofit I work for is small and cannot afford employer-based health insurance. I just increased my hours to where I still fall below the income cap. Does it have to be such a struggle just to continue to take the medications that have changed my life and allowed me to change the lives of others? But this isn't just about me. This is about helping thousands of West Virginians who face the Medicaid cliff and are stuck economically, on the edge. They are trapped between a rock and a hard place. They want to work more, have better jobs, but they can't. Health insurance is so expensive that it is out of reach, and they risk losing that, and the risk of losing that coverage could mean risking your life. With House Bill 3001, it's about improving our social safety net, changing them from a low ceiling that is threatening to collapse on working families if they try to make their financial home more sturdy and secure, into a solid hardwood floor that can be a stable foundation for individuals and families to climb to their feet. They can accept that promotion, take on those extra hours, and work harder without worrying that they will just fall behind. Thank you very much, and it is my pleasure to introduce Delegate Plush out.
Thank you, Jude. I just want to say, welcome home to West Virginia. We're so glad you're here. And we're very grateful you told your story because it demonstrates what this bill is all about. This bill, I was very affected by your story. This bill is about real people who have real problems. And he talked a little bit about, there are two kinds of cliffs that we're trying to resolve here. One is the Medicaid cliff and the other one is the marketplace cliff. And what Delegate Worrell said that this is kind of simple. And it's a simple solution that working people will pay for coverage to avoid the cliff. That's what this bill does. And the bill is HB 3001. Delegate Worrell is right that you need to speak with your delegates and your senators and say, this bill could help me, it could help my neighbor, it could help my relative, because we want people to work. And this provides people with a way to work and to work more. We don't want people like Jude or like others to ration their medication because they can't afford it all the way through the month. We don't want people who work overtime during Christmas to make money for their family, to pay for the Christmas. We don't want them to lose their Medicaid because they were doing what their employer wanted. We want people to be good parents. And to be good parents, you have to be healthy. You can't be worried all the time about finances. You can't be anxious all the time. And you can't be sick and risking going to the hospital because you're not getting the treatment that you need. So what is also really good about this bill is that it has bipartisan support. West Virginians want our legislators to work on bipartisan solutions. That is a desire that people tell me all the time. And the cool thing about this bill is that it's a very smart use of federal dollars. It says that if the state, I have to say thank you, as Delegate Worrell did, to experts who figured this solution out. There is a solution there, and it's a two-part solution for both of these cliffs. And the bill says to the state, apply for this waiver so these people who are hitting the cliff can continue to have Medicaid coverage. They'll help to pay for it, but it won't be a cost for West Virginia taxpayers. We think, if our calculations are correct, that it would be very low cost or zero cost. And isn't that amazing? So I want to say thank you to Jude. Thank you to all the groups who helped figure this out and to the expert that they recruited. And thanks to all of you who are here today and know people, real people who are having real problems, because that's what we should be doing during the legislative session. Thank you very much.
Well, I'm going to wrap us up and take it home. I'm Kelly Allen. I'm the Executive Director of the West Virginia Center on Budget and Policy. You've heard from all of our speakers so far today about how Medicaid buy-in would help ensure that workers and their families no longer find themselves in a difficult situation where improving themselves financially or taking a promotion or a new job would cause them to lose Medicaid and be worse off financially overall. Delegate Worrell and Plush Hour's legislation is both a compelling and powerful solution to the Medicaid benefits cliff, which again, we talked about this phenomenon that both legislators and the PHHR have expressed interest in solving as a means to filling job openings and ensuring that West Virginians have the resources that they need to go to work. So much of the legislative session so far this year has been focused on how do we get people to work? How do we fill job openings? This is actually the way that we do it. It's one way that we do it. It simultaneously promotes workforce and affordable health care and families. I did just want to take a moment to talk about the mechanics of the legislation, which Delegate Plush talked about a little bit, and the fact that she highlighted that we can do this at no cost to the state budget. Currently, a very small income fluctuation can be the difference between a household qualifying for Medicaid or not. It's very binary. That's why we call it cliff effect. You either get Medicaid with no deductible, no monthly premium, or you don't get it at all. And that's the cliff that people are dropped off of. And a buy-in would really stair-step people, right? They would see increasing monthly cost sharing as their incomes improve and ultimately be better off until they no longer need Medicaid anymore. And that's what a Medicaid buy-in does. This program would allow a person on Medicaid whose income increases above the requirements of the existing Medicaid program to pay an affordable monthly premium to stay with their same insurer, their same plan infrastructure, their same provider network. That means they don't have to find a new doctor. They don't need to go without prescriptions. They don't need to switch pharmacies or go without medical care. And as far as funding the program, as Delegate Plush said, House Bill 3001 directs state officials to take advantage of all federal dollars available to establish this program. And I won't bore you with the details, although there is a memo on the back table for anybody who's interested. But basically, there are two programs, the Affordable Basic Health Plan and a federal waiver that can be combined to ensure that the Medicaid buy-in is funded entirely by federal dollars at no cost to the state. But actually, we have reason to believe that it would save the state money in the long term. So this is really, really exciting legislation. It solves a problem that our legislators have been talking about all session long. It promotes work and family and health. And we, along with others who spoke today, urge the House Health Committee to take it up right away and for our legislators to support this innovative plan that's going to help West Virginians stay healthy and get to work. And I think I'm the last person, so we can open it up for questions of any of our speakers.